Hey guys, so I'm back and today I'm going to be working on my beautiful client. We're going to be doing microneedling on her. So as we can see, she has beautiful skin. She's young, has all that collagen, beautiful skin. She does have a little bit of acne on the top, so we're going to be avoiding those areas. But other than that, she just has some discoloration and some deeper scarring that she wants to get rid of. So microneedling is perfect to kind of plump up those areas with the collagen. So what we're doing is we're kind of disrupting the scar tissue that she has in order to create new collagen and new elastin. So it's going to go in kind of just essentially create that collagen so she gets like that new skin, nice and smooth, no hyperpigmentation. It's going to help with fine lines and wrinkles. It's going to help with pore size on the nose. So it's a really good all-around treatment as well. So yeah, and then we do numb with a medical grade numbing, so we make it as comfortable as can be. This tip is a one-time use. Only you use this tip, nobody else uses it. Once we're done, we discard it, so it's a new tip every single time, so no cross-contamination or anything like that. So we go in and we apply some like hydrogel, some hyaluronic acid all across the face to get a nice glide. And we're just gonna go in and create kind of pinpoint micro channels within the skin, so it's gonna tell the cells that you have a wound, so it's gonna go in and try to fix that wound, essentially is what we're doing. So it is kind of a controlled wound. And the reason that this is better than using a derma roller at home is because derma rollers come at not a 90-degree angle, so it's actually creating damage within the skin. So if you think about Jello, you have your Jello, you stick your finger in at a 90-degree angle, you pull it out at a good speed, it's gonna stay intact. But with the derma roller, since it's coming at an angle, all different directions, you think about that Jello sticking in your fingers like that, it's gonna completely mess it up. So the Jello is your skin, so we wanna make sure that we're going in at 90 degrees and doing it at a certain way, so that way we don't disrupt the skin all around those microchannels. So we're gonna go ahead and start. Okay. So erythema, which is redness, is totally fine. That means it's going in, it's doing what it's supposed to. In this day and age, we don't need pinpoint, like intense pinpoint bleeding. You will get some, which is normal. So you want to make sure that you stop the use of any NSAIDs, like blood thinners, about like 2 to 3 days before your treatment, because that's going to cause you to kind of bleed a little bit more excessively. So, but yeah, pinpoint bleeding is okay. Just full-on vampire facial, we don't need that anymore, because all we're doing is really just trying to get that collagen to start rebuilding and stimulate it. So just some slight erythema and pinpoint bleeding is great. You want to make sure that you hold the skin taut to really get in there and make sure that the pen isn't dragging. And she doesn't feel anything. So you can see she is getting a little bit of erythema, a little bit of pinpoint bleeding, totally normal. She's getting a great treatment. Any intense scarring too, you can go ahead and hold the pen over and just kind of give it a little wiggle over those areas to really work that collagen. So now we're going to move on to her forehead, and like I said, she does have some active acne, so we want to avoid those areas. We don't want to puncture them because it's going to spread the bacteria, which is a no-go. So we're going to work on the acne or the scars that she already has. Some great erythema, which is our clinical endpoint. So on the nose, you always want to tell your client that it could make them sneeze. So if they feel like they have to, just let you know. It's a little bit more sensitive, but it's great for really shrinking those pores. you.